Hey, it's Brett here, and we're going to go through a quick few things on communication in particular with this. And when we talk about communication, this involves phone, involves text messaging service that we have here, and obviously involves face-to-face interaction with people, particularly specifically with patients right now I'm referring to. All of this same stuff applies with teammates and people you work with in here as well too. So first and foremost, our communication needs to be clear. And that's the thing, as you continue to get involved here, you start to understand how we operate, and things become more clear to you. Therefore, your communication with people becomes better as well too. With that, it's that clear. That's also direct with people. Cut to the chase and help get them what it is that they need. If somebody asks for an appointment on a certain day, get them an answer pretty quick with stuff. The longer they have to wait, the more they get frustrated with stuff over a course of time. If they got a question about insurance, or they got a question about their billing, or they got a question about scheduling or visits or family member coming in here, the better we can get that question answered in a concise, direct manner with that, the better and more comfortable they're going to feel, more confident they feel in us, the better the experience is with us as well too with it. So, and even if that answer, honestly, in the beginning is, hey, you know what, I'm not exactly sure, but I'm going to find out and I'm going to get back to you. And that's a very direct answer, assuming the follow-up is with it as well too, which we'll come to on there. So that directness is ultimately kind of the piece that creates confidence with people on there. So just cut to the point, get to the chase, answer their question the way they asked it as well too. The undistracted piece as well too. That's why we're big on at the front specifically, or whatever we're doing, we're communicating with patients. We don't have a phone in our hand. We don't have something else distracting us. There's not 15 other things going on. We're not doing 5 different tasks at the same time during patient hours. It's we're locked in on those people. That undistracted communication, there's value to it. It makes them feel important, which that's why they're here at the end of the day, is they want to feel important and valued at that point. The other thing with our communication has to create accountability. This is probably the most difficult because it's the uncomfortable part of it, but at the end of the day, this is the part that ultimately creates, no matter what role you're in here, a person is in this practice, you're an accountability person. You are a provider. You're the one helping keeping that person on track to get the results that they came in here for to begin with. So that accountability piece, it's the person who calls and says, hey, you know what, today's not going to work. I just need to cancel my appointment. The simple answer to that is, okay, I'll get it canceled. Bye. The more difficult accountability piece of that is say, hey, you know what, let's keep you on track this week. Can we get you in tomorrow at the same time? No. Okay, what's the soonest we can get you in then? What day is better this week? Boom, get them scheduled at that point in time. The patient misses a visit, a regular visit on there, and no call, no show, or whatever might be the case. That communication that happens, the accountability piece, is that phone call, that text message that goes out after that simply says, hey, you know what, we missed you today. If we get a voicemail, we don't talk to them, you know what, I'm going to move you to tomorrow at the same time. If that does not work, please get a hold of us there. Our job is to help them stay on track. Every human will always go the path of least resistance. They look for reasons not to do anything. Our job is to help them to do something that's in their best interest at that point. That's what they pay us for here. Yes, it's uncomfortable sometimes because at the end of the day, no one likes to have to lead people, but ultimately at the end of the day, we know it, most people do not make healthy choices out of habit. They do it out of necessity or forced accountability by somebody else. That's us in this circumstance on there. So that's critical. It kind of goes along with the next step that, again, our job, and think of it this way, is that our job is to keep people on track. Our job is to keep them moving in the process. Anytime a patient stalls out in care or gets off track, the odds, especially as the time goes on, that gap gets bigger in there, the less likely they are to get back on track at that point in time. A couple days goes by, it's one thing. If a week goes by, they start to disengage at that point. They lose the importance of what it is that's going on with it. Even if they feel like junk, it's hard for them to get back into it because they've forgotten about the importance. They've even kind of forgotten about how good it was to feel good. They went back to the old crappy normal way of how they existed, which unfortunately they've gotten used to over a course of time. So keeping them on track is critical in regards to that. When communicating with people too, the types of questions we ask is important. The question of, hey, do you want to get rescheduled? Doesn't work, because now all of a sudden you give them an easy out. Once they say no, you have no other options at that point, versus they call and say, hey, you know what, today's not going to work or whatever, the question or excuse is at that point in time, the question simply is tomorrow or Wednesday a better day to get back in? So Tuesday or Wednesday better day to get back in? Wednesday is. I got a 3 o'clock and a 4:30. What works better? The 4:30 does. Great, we'll see you Wednesday at 4:30. That type of question, you're leading them into the right answer that's on there. And we do that because, again, intentionally our job is to keep them on track at that point. So we're going to help them make the better decision with it. Don't give them the easy out. Make them have to go through that process a little bit that's on there. The other thing with our communication on all these types of things, we need to follow through. We need to follow through with a promise to them to help them get the result they came here for. We need to follow through if we communicate with them on an insurance question and we say we're going to handle it. And we need to handle it at that point. Get involved, whoever needs to get involved to be able to handle that situation on there. That builds confidence. It builds trust from the patient to back to us at that point in time. And that's a huge part. It's a relationship business we're in right now in general, just like anything else. The other thing as well, too, that I would say from a communication standpoint is being proactive with things. In other words, when a situation arises and a patient asks about a scheduling issue or whatever might be the case on there, our communication can simply be, you know what, let's find a solution to this before it even happens. Let's help get you scheduled out a little bit more in advance on some of these things, or the billing stuff. Let's get things set up for you so that you don't have to pay every time you're in here. Whatever those things are, like how can you be proactive with that? That's why we send out reminders to patients. That's why we give them update emails and things along the ways to communicate with them in a way that helps them understand what's going on before they even get back into it. Or a patient has a change in their insurance. We try to be proactive with that so we don't have to have other conversations down the road that are more difficult at that point in time. So those proactive, engaging conversations to really get a patient to help make their experience better. Every bit of communication in here is, again, better experience, better results. At the end of the day, that's all we're trying to do with them. So hopefully that helps with communication.